Welcome to the Jewish Family and Children's Services Facebook live stream. Before we get started, I just wanted to invite our viewers to send along any questions that they might have in the text box below. My name is Boardman, and when I'm not hosting live streams, I'm a social worker and a mental health counselor in the Individual Family and Services Suicide Prevention Program at JFCS. Tonight, I am joined by suicide prevention experts Chodosh and Rachel Levy, who are going to be talking about suicide and suicide prevention. Rachel Levy has a master's in public health and has worked with JFCS as a suicide prevention specialist since October 2019. Rachel graduated from the University of Pennsylvania's Masters of Public Health program, during which time she worked as a health educator with the Center for Public Health Initiatives and Netter Center for Community Partnerships, in addition to working as a community initiative research assistant with the Agatston Urban Initiative. And Carly has a master's in social service and is a licensed social worker and care manager with the Jewish Family and Children's Services. She works primarily in the Orthodox Jewish community in Philadelphia, focusing on individual family services as well as community outreach for JFCS's Safe Space program. JFCS's Safe Space program uses an evidence-based curriculum to empower parents, educators, and teens on signs of suicide, as well as prevention resources. Welcome. Thank you both for making the time to talk to us about this very important topic.
Thanks for having us.
Yeah, thank you.
According to the Center for Disease Control, suicide was the 10th leading cause of death in 2018 in the US. And in that same year, 48,344 people died by suicide, and 1.4 million people attempted suicide. According to ABC News, in March of 2020, the Substance Abuse and Mental Health Services Administration reported an 891% increase in callers to their disaster distress hotline compared to the same time in 2019, which has experts worried that the rate of death by suicide is likely to skyrocket. Carly and Rachel, I was wondering if you can talk a little bit about how some of the social distancing protocols that are in place right now might exacerbate a pre-existing mental health diagnosis and contribute to this alarming spike. Carly, would you like to start?
Yeah, sure. So I think that before we start, I wanted to just say, this is a really hard topic to talk about. It's something that a lot of people feel uncomfortable hearing the word suicide. And I wanted to emphasize that one of the goals of us coming together as a cohort of mental health professionals is to really normalize the conversation around suicide, because really part of the solution is talking about it. And I think that, yes, we are in unprecedented times with COVID-19. And I also wanted to shift the language from social distancing, which is a term that we hear so frequently. It seems like it's in every headline, every news channel. And we really would like to change the narrative to call it physical distancing. Because I think that we have a lot of opportunities to socially come together as a community and to help treat people who are suffering from pre-existing mental health conditions. The fear with the social distancing or physical distancing, as we would prefer to call them, protocols, is really the isolation that can come along with it. And for people who are experiencing severe anxiety, distress, there's a lot of things to be anxious about right now and a lot of uncertainties in the world that we live in. So I think that one of the main concerns is that people are feeling extraordinarily isolated and alone and feeling like they have nowhere to turn to. And I'm sure that Rachel can speak to specifically the experiences of adolescents a lot of rituals have been canceled. A lot of community events have been canceled. This was supposed to be my master's alma mater's graduation was supposed to be this past weekend. And it didn't happen. So I think that those community disappointments are also exacerbating those feelings of hopelessness, helplessness, and loss. Rachel, do you want to talk about specific experiences of adolescents?
Yeah, absolutely. So I agree that we should definitely be talking about this as physical distancing and not social distancing. Isolation is a risk factor for depression. So, let's think of this as ways to not isolate ourselves, but just be physically distancing ourselves. In addition, it's really important for youth to feel connected. So they are feeling, distanced and separated from their peers or loved ones. They can feel isolated, they can feel lonely, they can be experiencing increase in stress or anxiety, thinking about, their own health or the health of their family or loved ones. Again, like Carly said, there's so much uncertainty here. So, they might be worried about things going on at home. They might be worried about financial stability of their family or, the relationships both in and out of the home. Again, a lot of us have had to change the way that we access our support systems. For a lot of students or a lot of youth, it could be talking to friends at school, seeing teachers, seeing coaches. So there had to be this shift in how we access our support system, which can be really difficult for youth. So again, it's really important to think about, think of it as physically distancing, because if we are socially isolating, if our students or our youth are socially isolating, that can definitely exacerbate any other, kind of pre-existing mental health condition.
Thank you. That really helps. So one of the things though that I think is challenging, you were talking about accessing our support systems, and people don't always feel comfortable or safe reaching out per se. And a lot of times people don't tell others about their mental health challenges. So how do we know if something's wrong? And how do we know when to reach out or not? I guess what I'm asking here is what are some risk factors and warning signs?
I can start with this. Actually, I'm really happy that you brought this up. Talking about protective factors, safety planning is a term that we use a lot in the mental health world around how to work with people who are feeling suicidal in when those feelings arise or when they're feeling an uptick in depression and anxiety. What safety steps can we put into place? And one of the things that Rachel and I both touched upon, but we didn't call out directly, is that all of our routines have been completely disrupted by all of these physical distancing protocols. And a lot of the steps that might have been in a pre-existing safety plan might not be accessible because of all of the changes that we've had to make in order to protect our physical health. So I think that, what normally would be a warning sign that somebody is experiencing an uptick in depression and maybe is feeling suicidal would be someone no longer following their normal routine, sleeping excessively, not eating or eating excessively, not coming, not interacting with loved ones or family members. And all of those things are kind of the reality of the world that we're living in right now. So when we're talking about risk factors, I think that the rules have changed a little bit. And I think that anybody who has a pre-existing mental health condition that's related to depression or anxiety would be considered at risk for suicidality. And if there's somebody that or if you're feeling depressed or anxious about anything that's going on in your life, it's okay to alert the people that you feel safe with. And it's okay for you as a safe person to check in with those people that may be struggling with those things in their lives right now. And I think that if we can recognize that the rules of risk factors have changed, then we have a lot more for an agency to be able to intervene and create a new safety plan that works with the new protocols and the new reality that we're living with today.
Yeah, very important. Thank you. Rachel, is there anything you'd like to add?
Yeah, absolutely. So Carly mentioned a few risk factors. One of them is, youth experiencing a loss. So we talk about a loss, maybe it could be a death of a loved one or someone or someone who was in your school, or a loss of a relationship. But we're living, in these times right now, we're in this current situation where students are experiencing a lot of loss. There's loss of dances, there's loss of extracurriculars, activities, it's loss of time with friends, graduations. So this is kind of a new forum of loss a little bit that that youth can be experiencing. Other risk factors would be, a family history of depression or suicide, or, one's own mental health conditions, or if they've had a previous suicide attempt. Another risk factor is self-injury. So we wanted to touch on this for a minute, because self-injury, which might be someone hurting themselves, like cutting, it doesn't mean that someone is hurting themselves with the intention to die, but it does increase somebody's risk for suicide. So it is when someone is dealing with an intense emotional pain and they are unable to access, those healthy coping mechanisms to deal with the pain that they're experiencing. So, self-injury is definitely something that should be addressed. That is a risk factor. It shouldn't be ignored. I know you wanted to talk about warning signs as well. There are a bunch of warning signs to look out for in adolescents, in adults, in yourself, really. Some of them are a sudden change in behavior, like a change in sleeping or eating or other behaviors. In teens, it might often look as anger, like a very extreme anger, or coming out as self-hatred. It could manifest itself physically, like unexplained headaches, stomach aches, or fatigue. One is no longer caring about personal hygiene. I know we're all home, so it's easy to stay in pajamas all day and kind of, not care about the way that we look because we're home and nobody's seeing us. But sometimes it's like going a little bit extreme, not caring about hygiene at all. Other warning signs are isolation, like we talked about earlier. I know I have a long list of warning signs, but these are just a lot of things to look out for. A student or a youth not partaking in any activities that they used to enjoy. So if they're isolating themselves from their friends, no longer talking to them online or talking to them on the phone, or, there's so many different ways that youth can communicate with their peers. If they are sort of dropping off, if you're seeing that your friends are no longer posting, that might be a warning sign. Or if you see that they post things online that are concerning, if they're talking about suicide, if they're talking about death, that might be a moment to stop in and say, hey, I see these things, these are concerning. Or, there's also online bullying. If you see that a friend or a child is getting bullied online, that might increase some risk. Again, just lastly, there are normal amounts of anger and frustration and disappointment and sadness, especially at this time. People are experiencing a lot of these feelings. But if these are feelings that someone feels like they can't shake, if it's an extended 2 weeks or more, if someone feels like they can't access those healthy coping mechanisms, then that might be a really big warning sign for suicide.
You said 2 weeks or more.
Yes.
Okay, that's important. And so I think that really, you mentioned talking to people about their thoughts of suicide. How do we talk to friends or students or loved ones about suicide? I think a lot of people believe that it's dangerous to ask people if they're thinking about suicide. And I was wondering if you could comment on that, and also talk a little bit about what we can do if a friend or loved one tells us that they're thinking about suicide.
I can start with that one. I'm glad that you brought up that people are often worried that if you ask or you say something about suicide, like Carly mentioned earlier, there's this whole stigma about talking about mental health, and we're so worried to talk about it. But asking somebody if they are suicidal, if they're thinking about suicide, just talking about it does not put morbid ideas into their head. It is really protective to stop and ask somebody if they are thinking about suicide, if they are having these feelings. It gives your friend, it gives your family member an opportunity to open up about the way that they are feeling. It lets them know that you are there for them. It can help them feel feel less of those feelings of isolation if they now feel like they have someone that they can come and talk to. And this is, you know, a slogan that we use in the schools. This is with the Signs of Suicide program is if you see warning signs, to use the acronym ACT. So it's acknowledge, care, tell. So, you know, you acknowledge that you see behaviors that are concerning, or that you hear your friend or your family member, or even feelings in yourself, things that are concerning that you are worried about. You let your friend know that you are there for them, that you are worried about them. You make time for your friend to listen to what they have to say to you. And you tell a trusted adult, or you contact suicide hotlines, or if you are worried that someone is in immediate danger, call 911. So lots of ways to reach out. I don't know if Carly, you wanted to add anything else into that.
Yeah, I just really want to echo what you said, that if somebody's already experiencing thoughts where they feel like life isn't worth living, there is no harm in asking about whether someone is feeling suicidal. If they're already having those thoughts, asking about suicidality, and even if they're not having those thoughts, asking someone, are you feeling suicidal? Do you want to end your life? Is not going to put any ideas in their head. And that's true for adults and for adolescents and for youth. I think that, you know, we've seen in our own practices with our clients, the amount of relief that the majority of them feel when we finally verbalize the question, are you thinking about ending your life? We see that relief on their faces. And it is such a, it's a very, it's an integral part of the healing process to be able to talk about those feelings in a way that's non-judgmental and without any sort of, you know, value judgment based on the way that they're feeling. So I really want to reiterate that point. And I think the other piece is really to just have the conversation. It might be awkward the first time. It might, you know, hopefully you only have to have the conversation one time. It might be awkward, but getting over the awkwardness is worth the discomfort for both people involved. And being able to have an honest conversation where you're able to make someone feel cared for and valued can be incredibly curative in helping them to get the help that they need and enabling them to access the care that they need in order to begin their recovery process. So the most important takeaway is to just have the conversation.
Imagine a lot of us are thinking about the people we care about right now. And you mentioned helping. Are there any things that we can do to help put things in place to protect people who are experiencing symptoms of anxiety or depression, specifically including suicidal ideation?
Yeah, I think there's a lot of things. And if we could bring up our resources slide, I think that there's some great resources out there that are available for people who are both feeling suicidal and who have loved ones that they're concerned about who are feeling suicidal. We also included, we have on our JFCS website, on our COVID-19 resources, a bunch of mindfulness and self-care tips, which can really be preventative in helping people mitigate some of the stressors in their lives, which may make the anxieties and depression that people are feeling a little bit less acute. So there's a lot of, these are resources for you to call if you ever believe that you are in immediate danger, or if someone that you know is in immediate danger. Don't hesitate, call 911. They will come and assess the situation. If you're ever unsure, there are crisis lines in both Philadelphia, Montgomery County, Delaware County. We only included Philadelphia and Montgomery County because that's where our offices are. But there are crisis lines for every county in Pennsylvania, and you can call them. They'll actually send mental health professionals out to the location to do an assessment with somebody to evaluate them for suicidality before making a decision about whether hospitalization is needed. And those are great resources that I think every person who has someone that they love, that they should have those numbers saved in their phones. And then Rachel, do you want to talk about the teen resources that we have here also?
Yeah, absolutely. And then, you know, I just wanted to mention that there are a lot of things that we can do, right, to, you know, a lot of things that we can put in place for ourselves, healthy coping skills that we can have, that we can work on for youth and for adults alike, to access to kind of deal with anxiety or depression. I want, at the beginning, Carly said, let's normalize this conversation. Absolutely, that is something that we can do as friends and family members for our young people, is normalize this conversation, check in with the people that you care about, have resources in place, right? So those resources that we just put up, those are great to have. Check in with people who, who might have, been going through some things, going through some loss. Other protective factors could be just being a part of a community, or we're not in school, but maybe checking in with your club members or other, teams that you were a part of. Connect as best as you can with family and friends at this time. Find things that you enjoy. I know for me, I need fresh air, which is hard to do at this time, but I have a dog who requires that we go outside. So that's good. Find ways to do the things that you enjoy that help you feel, comfortable, help you, if you're feeling stressed or anxious. It could be anything, writing in a journal, listening to music, maybe make a plan of things that, like I think Carly mentioned earlier, like a protection plan, right? So make a list of the people you feel comfortable talking to, make a list of the things that you can do when you feel stressed or anxious. Keep those other resources available, the mental health resources, right? So we talked about the suicide hotlines, their text numbers, which are great for people who don't want to talk on the phone. There's a website called MindWise, which is where we is the Signs of Suicide program that we work with. They have a lot of activities for parents, for teachers, for young people. So they have a lot of different activities, such as like breathing exercises. There are different apps like the Calm app or YouTube pages of, one good thing that's come out of this is a lot of organizations and companies have come out with ways that we can feel like we can de-stress at home, take advantage of all of those things. Look on YouTube pages, look at free resources that are available to you that might help one relax when they need it.
That's great. That all sounds really, really good. Does JFCS have any programs that you think could be especially especially supportive to our viewers?
So one thing that I really want to highlight is that we have a large community of first responders that are really facing a large amount of prolonged trauma on a regular basis, which is exacerbating any pre-existing mental health condition and is, contributing to feelings of anxiety and depression. JFCS has a really wonderful network of resources for first responders, healthcare professionals that are working on the front lines of COVID-19. And the information for that can be found right on our webpage or at jfcs.org/support for healthcare professionals. And we know that the numbers are starting to roll in, that healthcare professionals are an extraordinarily at-risk population when it comes to suicidality. One thing that I really want to highlight is that we've started offering mini self-care sessions, which are 15-minute scheduled sessions with a mental health professional without, becoming a client. There's no intake procedure to go through. It really is just for decompression, reflection, venting, and anybody can take advantage of those. So those resources are available also on the resource page that was just shared and will be posted in the comments as well, if it isn't already. So I think that those programs are really important to highlight. We also have a large amount of support groups. One thing Rachel said that is so important is focusing on connectivity, making sure that people feel connected to each other, even when we have to be physically apart. For adults and for youth, is something that is extraordinarily protective for anybody who's facing anxiety and depression, anybody who's feeling any suicidal thoughts or behaviors, and utilizing some of those amazing support groups that we have would be a way to find social connection and find meaning in all of the chaos that we are constantly living in.
Yeah, wonderful. Thank you so much. That all sounds very supportive. Okay. Do we have any questions from our viewers?
We actually do. We've had a number of people said, thank you for the resources, that it's very helpful. The link is in the comments, as well as the link to the support for healthcare professionals is in the comments as well. So I have some questions. The first one is, what if my young child says he wants to kill himself because he doesn't like his or her life right now? How do you respond as a parent?
That's such a hard situation to be in. I think that the first, I mean, I don't know how young your child is. You know, I have 2 little ones at home, and I could imagine a child saying something like that out of stress without really understanding the gravity of what they're saying. But I think anytime a child makes a statement that they don't think that they don't like their life right now, or they want to end their life, it needs to be taken seriously. And I would say, you know, to have the conversation, maybe not in the heat of the moment, but maybe, you know, do an activity together to calm down, and then to have the conversation about what the child is feeling internally, and then make an assessment from there. I'm sure Rachel has more to say on the topic as well.
Yeah, I mean, definitely what you said is absolutely correct. I would really take the time to listen. I wouldn't try and problem solve. Really listen to what your child is saying to you, and try and see if they are interested in talking more about it. If you are concerned at that moment that they might hurt themselves, call 911. Offer these are the resources that we mentioned are good to have in your phones to kind of have offhand to connect your youth with right away, because they don't need you to talk to somebody. They might feel like they want to talk to somebody else. So I would sort of give them that safe space to allow them to have those feelings that they are having, but definitely connect them with resources, and just make sure that they get any kind of help that they are seeking. Don't ignore what they say. Don't think they're just trying to get it for just saying things for attention. If they are saying it for attention, that means that they need that attention.
Which is a very good segue to the next question that we received, which is, how can you tell the difference between suicidal ideation and manipulative threats?
So I think going back to what I just said before, anytime a youth is making a statement that includes any sort of threat to end their life, it needs to be taken seriously. And even if the only thing that the youth learns is that they can't make those threats because they will be taken seriously, you are messaging the correct thing as a caregiver.
Yeah, absolutely. At youth always, if someone dies by suicide, they often have given some sort of warning sign, and saying that is not for attention, to just, give that attention that they need to the things that they are saying. Don't ignore those signs.
I have two more questions, but they're very similar in that, what if the person is just difficult to talk to? Like, it's very hard to have this kind of conversation. Are there certain introductory questions or leading questions that are a good way to begin these talks?
Well, you can talk about the things that you've been seeing, the things that you've experiencing. So you can't, maybe don't come at the attack saying you've been very angry lately, you've been irritable. Say, these are the things that I have been seeing. I am worried about you. Let them know kind of what your experience has been, seeing what your young person or, friend or family member is going through. Try to do your best to be patient. Try and do your best to listen. I think listening is really important, to not just offer solutions or kind of yell back. Yeah.
I think also emphasizing the amount of care and concern that you have for someone is always a good place to start. I know these aren't easy questions to hear me ask you, but I'm asking because I care about you, I think is a really good place. And then, like Rachel said, using I statements, I'm noticing a few things that are worrying to me, and I just want to make sure you're okay. I think that if you use language like that, they might not tell you their whole story, but they will certainly be relieved that you asked and that you checked in.
Let me just do one last check. I think that's all the questions that we had. Let me just one more time. Yeah, that was our last question. Let me show the contact information for JFCS one last time before we wrap up. There's our phone number, and that's the website to go right to the resources. And again, the resources that we shared earlier, there is a link right in the comments, as well as to the healthcare professionals website.
All right, well, I would like to thank both Carly and Rachel for being with us tonight and for sharing all of their knowledge. And I want to thank Deb for all of her hard work manning the computer. And I want to thank our viewers for joining us tonight. And I want to invite you all to check back next week for another installment of JFCS Facebook Live. Stay safe and healthy, everyone. Have a good night.